Hello, I'm Dr. Lulu and your fabulous host of the Genetic Genius podcast. Welcome back to my channel. On this week's episode of the Genetic Genius podcast, my guest, Dr. Jennifer Quartano, discusses the benefits of using DNA analysis and epigenetics when planning a family, a healthy pregnancy, and fertility optimization. Dr. Quartano is a dual board certified physical therapist in pediatrics and neurology with a passion for seeing children and families grow successfully and thrive together. She has a vast experience working all the way from neonatal intensive care to the functional fitness environment and everything in between. After seeing the failures of the traditional medical model, she began her own practice in 2014, allowing a focus on the child and family together to maximize relationships and life quality. As a mother herself, she understands the challenges parenting can bring, and she seeks to bring the expertise in how we think, move, and act to influence how families learn, grow, and thrive. Through this experience and her own health journey, Dr. Quartano has found a passion for functional medicine and has undergone training with an Institute of Functional Medicine affiliated program to be able to offer this unique approach to health to others. She understands the stress and roles that personal and professional life take on health and seeks to help other women find their best self to be the best mom, wife, professional, or athlete they desire to be. One of the tools she uses to do this is genetic testing to focus on personalized healthcare. Her favorite test for moms-to-be and pregnant women is Grow Baby. Hi, everyone. Welcome back to the Genetic Genius podcast. And I'm so thrilled to have my guest today, Dr. Quartano, and we're going to be talking all about family planning from a genetic perspective. Welcome.
Thank you. Thank you so much for having me today.
You're so welcome. I'm super excited. One of my favorite topics, of course, is genetics. But also, I love talking about family planning because it's so important right now, especially fertility, optimization, and all that good stuff.
Absolutely.
Yay. So before we get started on this amazing conversation, I'd love for you to introduce yourself. Just talk about who you are, how you got to be where you are today, your passion and purpose on the planet.
Yeah, absolutely. So my background is as a physical therapist, and in years of working with pediatrics primarily, what I realized was there was so much more of a need for family health, and that if the families weren't thriving, the kids weren't thriving, and it didn't matter how great my interventions were. And so I really started targeting moms and just family routines and lifestyles, and got into functional medicine that way, and then really dove down that path in my own healthcare. And then have come full circle to start applying that back to my care for young families, and particularly young moms or moms who want to be moms who are struggling to get pregnant, stay pregnant, or have healthy pregnancies, and a lot of fears and concerns around that. That's what I'd love to talk about with you today.
That's great. And I think it's such a hot topic because so many of the younger generation, they're trying, or not even the younger generation necessarily, but women in general and single moms, couples, all different people are trying to have families right now and running up against specific barriers. So I think it's really important for people to understand, especially when there's a lot of the tools that are easy to access when you just know what they are.
Absolutely. And one thing I found and I'm so passionate about is changing that moment in time where we are today to change the future generation. So appreciating that if we can prevent all those things early on, we can make changes not only for that child and that pregnancy, but for the lifetime of that child and their generations to come, which is so powerful.
Oh yeah. So important. 100%. And we're basically what we've already done to our bodies is what's happening to our children, except from the epigenetic perspective.
Exactly.
Yes. So that's a great place for us to start. So let's just first talk about like family planning and genetics in general, because I know that there's lots of different, I would say, like not like fear factors, but people like, oh, a little bit of hesitation. So I'd love for us to just talk about genetic reports, like how they can be influential for the beginning stages of family planning to take away that fear factor.
Yeah, absolutely. And I think I've run into so many women who struggle with hormone balance in general and how that can influence pregnancy. But then there's so much fear around pregnancy and healthy pregnancy, or maybe they've had a bad experience or have a family history of bad experience, that I think even just starting from the basics of education of how important reducing that stress is and enjoying the process and making that as stress-free as possible is so important. And one of the ways we can do that is by having all the tools. So the more you can work with it and adapt and process. And so I think that's a big component of what I enjoy about this process is it's so informative and knowledge is power.
I love that. Yeah, it's so true. And I think when providing this genetics is so new on the scene too.
Right.
And I think we're learning so much so quickly. And people are like, oh, wow, this is when it first came on. I think it was a lot about ancestry, which is still important. But now in the past 5 years, it's changed so much. And it's one of the reasons why it's my passion. It's so fun for me. But when I see patients have that like seed of empowerment that you were talking about, and it's just amazing to see them like, oh, wow, I can do this. And then we're going to talk about what this is.
Yeah, absolutely.
Gene expression.
Yeah. On the other side of it, I think is sometimes it just takes that concrete black and white perspective in front of you. And my own genetics were a great example of that. Like I knew I had a problem digesting dairy. It wasn't until it was really black and white in front of me that I finally just said, okay, I really need to get rid of it. And so I think that can be really powerful for a mom to be who really wants this in her life too, to know these are the things that not only are important for my health, but for my future child's health as well.
Yeah. And actually learning that you have that piece of empowerment for your children, right? It's not just like guesswork. Oh, maybe if I eat a healthy diet, my children are going to grow up healthy. So it's super empowering from that perspective to really know that you can make a difference in your children's genes.
Absolutely. Yeah.
Yeah. Okay. The genetic report can be super helpful and influential. So talk to us about the Grow Baby DNA report. How does it help moms to have a better like understanding of their health and the health of the baby and their future children, so to speak?
Yeah. So Grow Baby is part of DNA Life, which is a line I love. And it's different from their DNA Health or other traditional testing in that it truly just looks at the factors from a pregnancy lens and healthy pregnancy, healthy baby perspective. So it can give them information on things like how they metabolize lipids or inflammation or detoxification. But what my parents and my families really care about is what that means. And so how does that translate? It's things like full-term pregnancies, reduced risk for gestational diabetes, reduced problems and potential issues with DNA changes and genetic conditions or lifestyle presentations like autism. Optimize that pregnancy and that health with these tools to optimize all those pieces for them so that we can not guarantee, nothing is guaranteed in life. Optimize, set us up for success with a healthy pregnancy and a healthy child from the start.
Yeah, so important. And just to clarify, when you have a genetic report done, it's not a stamp that XYZ is going to happen. Just like you said, it's not a guarantee. It's not showing that you or your children are going to have a specific disease or a specific thing. It's about prevention, correct?
Absolutely. Yes. And optimizing your health so that you have a healthy pregnancy, you can feel confident going through that. And we address that from diet, lifestyle, and then if needed, supplementation factors, but all the things that we can change and can control to set us up for.
That's so great. And I think it's really empowering to know that when you have a genetic report done, I love how you were talking about having that fertility optimization, having the whole aspect of your pregnancy, the best that it can be when you have the tools available. And I think that's like cutting edge right there. That's stuff that we didn't know before. And then in the past couple of years, if I have this report done, it can actually help me to have the best pregnancy possible.
Yeah.
And there's always wrenches that go in the mix, but
absolutely. Well, and I think unfortunately, too many times we're reactive instead of proactive. So it's not until that sugar test doesn't go well or that child isn't measuring where we want them to, that parents go looking for those solutions. And I think this is a nice way to be proactive and say, okay, based on me, this is what I can do to optimize and hopefully prevent all those things from being an issue to begin with.
Yeah, so true. And is there a time frame when you're working with someone in that preconception phase and that you would say, okay, I think this is a great time for us to run it? Or if you're already into the pregnancy phase, can you still run a genetic report and find out information at that time? And what's like the window?
Yeah, so that's a great question. I think for clients who are already working with me, we're doing a lot of this stuff already. So as they're getting closer to that point of optimizing fertility, it usually takes about 3 months because we've got to have those cycles to improve egg quality, sperm quality, all of those things. Then it's time as they're starting to think about pregnancy and we know their body's primed for that to then get this information so they can hit the ground running. But it's not too late. Into the first trimester would also be a great time. So if it's somebody who I haven't been working with, that absolutely is a reasonable time. second trimester, maybe early on, and beyond that, by the time we get the results back and moving into third trimester, I don't know that we would have enough time to make a big impact on them. Certainly could be helpful for future pregnancies, but I would say probably that first trimester would be the sweet spot if they're coming in already pregnant.
Yeah, that's great. So when you run a genetic report for the mom to be,
Yeah.
How important is it for the partner to have a genetic report done as well? And do you have a consultation where you talk to them both together?
Yeah, that's a great question. So typically when I'm looking specifically at this, I'm primarily looking at mom because a lot of what we're looking at is how their body is going to respond to the pregnancy and optimize that pregnancy and support the baby. There's plenty of other things when we're talking about preconception that we definitely want to pull dad in and make sure that dad's obviously healthy. And that's a super important piece. And I know you've had some previous guests on that have talked about that, but then also just that component of them together, because I think lifestyle wise, so much of the support that comes in during pregnancy comes from that partner and dad. Both there is super important to understand why this is so important and how they can support each other to make sure that baby is healthy and happy and everything goes as smoothly as possible.
Or any couple, it doesn't have to be mom and a dad.
Yeah, right. Yes, exactly.
Or it could be a single mom or, or a single dad.
Right? And whoever that support is, right?
Right. Yes,
but having that support there is super important.
Yes, totally. We support everyone who wants to have children.
Yes.
As long as you're ready.
Yes.
We're ever ready. But yes, as ready as you can be.
Exactly.
So it is good, like you mentioned, to have that during the preconception phase to possibly bring in the partner or just to look at family genetics so that you're on the same page. But I love what you said about the lifestyle component and talking about, and we're going to talk about that from the epigenetic factor. And I want to talk about one more thing before we jump into epigenetics. So when you're having these genetic reports run, do you use them to personalize like food plans and supplements for the mom to be?
Yeah, absolutely. So typically the way I will use this if somebody's coming into me already having pregnancy support elsewhere and just looking to optimize their pregnancy is let's meet, let's go over your history, your family history, what you've had so far. Let's do the test. And then let's do a session to interpret that and go over based on your biggest risk factors. What do we want to prioritize in terms of lifestyle? Do you need to make sure you're focusing on quality sleep or moving your body every day? Or what are those things that are going to be most important for you from a lifestyle perspective? What are those diet changes? Are you needing to include more selenium? That's a relatively easy thing to do, but we can incorporate that. Or more fatty fish. What are those things to include in your diet? And then if needed, what else do we need to supplement with to make sure that you get what you need?
Yeah. Oh, I love that. That's great. And I think that's another really fascinating piece for me. I love it that we can see that from a genetic report. Like people don't realize that. Like we can see what foods are good for us to eat or in alignment with our genes. And I love that. And lifestyle. And we'll talk about that from the epigenetic perspective. So what are epigenetics? How do they influence gene expression and how can we affect our genes and how they work?
Yeah, so that's a great question. The way I've explained it to a lot of my patients is epigenetics is essentially how we bloom. So how we water the flowers so that we see what comes out of that. So for example, if you've got hydrangeas and you put more acid on them, you get a different color, right? So the same thing is true of our genetics. Just because we have a gene makeup doesn't mean that that determines exactly how we're going to present. So epigenetics is what we're putting into that to get what we want out of that. So that is essentially how we influence it as well. That acid, as we would put on our plants, would be things like our lifestyle factors. How much sleep are we getting? How much exercise do we need? How much stress do we have and how well do we manage that? Or what do we need in our diet? What diet is optimized for us, which is something we go over in this, but then more so even in other ones, specifically here talking about pregnancy. And all of that is going to influence then what we get out. So who we are as humans and how healthy we are and what we're capable of is all influenced by all of those things we put in.
Right. And it's like we're our own individual magic formula. And so what we have in our soup around us that we can pull in those ingredients to make our magic formula then ignites us for our best and optimal.
I love that.
Yeah. Our magic soup.
I love the magic soup.
Magic soup. Totally.
I just pictured like my cleaning out the fridge. What am I throwing in?
Yeah.
But it's true. If you throw in the moldy stuff, you're going to get bad soup. So like, let's take bad stuff out.
Yeah. We don't want to have a gross soup for dinner. We want to have the best one. Yeah. But yeah, we are our own magic formula. And that's one thing that is so important. And I think people are just starting to understand about epigenetics is what everything around us influences our genes for their own individual expression. We have so many of them.
Right.
So they're all influenced. It's just you put this in the soup, you put that in the soup, and you could have a whole different ratio of
Right.
outcome.
Right. And the good news is it doesn't take much, right?
Right.
Like a little bit of this spice changes all the soup. And so a lot of times when we can be that personalized and prescriptive, epigenetics is so nice because it gives us the exact way to make the soup better.
Exactly, exactly. Love it. And so let's talk about breaking down. You mentioned some of those major epigenetic categories, and there's a lot of
Yes.
different ones. So I'd love for us to break down the ones that probably are like maybe the most influential to the moms to be that are listening. So let's talk about nutrition, because I think that's a huge piece. So foods, how do they impact our genes, especially in that preconception phase and phase of pregnancy? And are you looking, I mean, you mentioned it a little bit. What are you really looking at? And maybe give an example of a case, if not,
Okay.
of course, within HIPAA. I don't have to describe
Right.
it
Right.
completely,
Yeah.
but maybe a case that came in and what types of things you're looking at. Cause I think that would really help someone to understand the depths of it.
Yeah, sure. Sounds good. So, nutrition is one of those factors that obviously we hear a lot about eating healthy. I think people get focused on organics and things like that, which is super important. But
Mhm.
specifically when it comes to epigenetics, for example, what we might have is somebody who, let's say, has difficulty with some sort of detoxification genes. And
Mhm.
so, in that situation, we might recommend something that is going to support that detox process, making sure that they've got the right green leafy vegetables, enough broccoli, enough Brussels sprouts, some of those factors in there, healthy nuts and seeds that are going to help support those processes to make sure their body can detox. Detox is important because everything we take in is part of our toxic load, right? So what
Right.
from stress to the chemicals we run into, and we can't avoid them. They're in our
Right.
air,
We're
they're in
not
our
living a
food.
bubble.
We can optimize our body to get rid of them. And we're optimized for that. Then we can make sure we're setting ourselves up to prevent things like small for gestational age delivery or pregnancy loss, potentially miscarriages. All of those things have been linked to our body's ability to detox. And so those are some
Mm.
of the things we can get out of that report and come up with a very specific plan to say, okay, these are the things that are going to help you optimize your pregnancy despite having the genes that maybe don't optimize your detoxification.
Oh, I love that. And what if someone was on OCPs, on birth control prior, and do they
Mm,
need to detox that from the system to have
yeah.
regular menstruation
Yeah,
cycles?
that's a great question. I think it's incredible to me. And thankfully, we've seen a little bit of change in those contraceptives over the years that they aren't quite as bad as they used to be, or at least some forms of them. But at the end of the day, yes, most women are still going to have some residual impact to that. And so, in those few months leading up to pregnancy, part of that process is to optimize that detoxification, get
Hmm.
those things out of our body, eat the right things, drink plenty of water, move our bodies, all the things that are going to help detox so that when it comes time for that egg and sperm to meet, that the body's ready for it.
Exactly. You want to have the supreme meeting.
Yes. And of
This,
course, that's
mhm.
gonna, I'm so sorry,
No, no.
that's gonna influence pregnancy as well, or just the
Right.
ability to get pregnant. Because if we haven't optimized those things, then our hormone levels aren't gonna be regulated.
Yeah.
And even just being able to have that chance for that meeting to occur requires us to detox prior to getting pregnant.
And for implantation too,
Mhm.
correct? So having that, like
Yes.
everything wants to be an optimal,
Right.
right,
Right.
as we can.
Yes.
So yeah, it sounds like that detoxification period is very important for the preconception phase.
Absolutely. And like I said, our bodies are pretty magic. It's about 90 days or 3 cycles for women, about 3 months.
Right.
Men, it's about the same. So sperm are about 72 days, a little bit faster. But if we're working on that detox process, it takes about 72 days for them to be ready as well. So our bodies were
Mm.
designed to be in alignment for that. And hopefully, like we talked about, to be ready for egg and sperm to meet, whatever that looks
Yeah. So
like.
it sounds like it's just as important for both partners to be in
Yeah.
that phase of like, okay, yeah, we're going to do this together, which is always great. You want to be
Right.
working together in that
Yeah.
detox phase, which can be challenging for someone if they're coming off a lot of different things, correct?
For sure. Yeah. And I
Mhm.
think that's why it's so important to have that community piece too, because that just helps with family planning and preparation if you've got somebody in your house that's going to do it with you. So now you're bringing yourselves closer together, making this a more enjoyable bonding experience, and then you're setting yourself up for this great experience going into pregnancy.
Yeah, totally. And what are some of the foods? You mentioned some of those detox foods, and what are some of them foods for like fertility optimization, for really helping, let's see, the egg and the sperm meet or implantation? What are some foods you're like, these are ones we really want to have on board to have, or is it all specific for genetics and the genetic report, depending on the person?
That's a great question. I think there's a component of it that's definitely specific to each individual, but I would say just in general, eating a healthy diet full of phytonutrients. So we want to really eat the rainbow. That's super important. And when I think people get caught up in that, but really I'm like, it's as simple as it is for my toddler. So if you have red food, blue food, let's just get some variety in there. Dark green leafy vegetables, always important as well. And then probably the bigger ones on the other side of that would be our fish. I love good fatty fish, like good healthy salmon. Any of that can be really helpful. And our nuts and seeds, just making sure we have enough fats to produce and support those hormones. And then there's plenty of other vitamins and things like that, whether they're getting them in their diet through that phytonutrient or again, supplementation if needed too, that I would say are important.
Are the key. And what about so you're reducing mainly like inflammatory foods, like, sugar and things like that? What are some of those big avoiders?
Yeah. So I think sugar is probably a huge one. I know, right? All the way around. It's not optimal, right? When we talk about inflammation, and of course, getting back to genetics, that's going to give us a better picture. But the reality is most of us eat way too much sugar and inflammatory foods, quick processing carbohydrates. And so getting rid of those things, dairy tends to be another one that's pretty inflammatory for most folks. So cutting out some of those major ones. And then really the other thing I really like to look at a lot are the omega ratios. So are I getting way too much of that processed oil and not enough of the good healthy fats as well?
Yeah, so important. And you can see, like you mentioned, the dairy, you can see a lot of those things on the genetic report. Is that correct?
Correct. Yeah, we can start to get information about, and from this test in particular, how it's going to influence pregnancy, but then from the other genetic testing, so depending which ones we run, information more about how your body processes that or what kind of recovery you have from workouts. So do we need to tailor your workouts more to optimize your own health in order to get pregnant as well, for example?
Great. Love it. I love it. I love food. I love talking about food. It's so important. And I think so many Americans particularly are in the standard American dietary plan. And there's, I love you mentioned that, especially from the functional medicine perspective, the rainbow of foods is so important.
And yet it's so hard for a lot of my folks, even just coming in, they're like, but that's not what we eat. Drive through the drive-through on the way home and there's nothing but brown on my plate. So sometimes we even just start with being aware of what we're putting in our body and where those other healthy choices are that are still going to fit their lifestyle. Appreciating that if we bring a baby on board, it's only going to get more stressful, more difficult. So let's make these healthy habits and changes now so that we can have a good, healthy post baby as well.
Yeah. Oh, I love that you said that, having those healthy habits now, because that's so key. And I was so fascinated when I have patients, the same thing, when they come in and they say, oh, I eat every meal out. I'm like, how is that possible? I don't know how people survived COVID, if that.
Absolutely.
But yeah. And I think that's not even just for pregnancy and optimizing family, but for everyone, just like education about what we eat and learning easy things that are fast. And it's just a learning process. And I'm sure you find that patients feel overwhelmed sometimes when they're faced with, oh, really? I have to change everything I'm eating.
And I think that's so important that you said that, because if you're listening to this and you're like, wait, I have to change everything, I can't do that. It's okay. There's a reason DoorDash came around and was so big during COVID, because you're not alone if you're eating every meal out. That's a lot of our American diet, but it's also part of the reason we're at where we are with disease and all the things we have in this country. So let's start small. Let's figure out some changes that we can make that are going to be super impactful for you. And that's one of the other reasons I love genetic testing, food sensitivity testing, all of those things, because we can really personalize it. And if it seems too overwhelming to make all those changes at once, then we can really start with the changes that are going to be most impactful for you.
Exactly. The foundations. Yeah. I was just working with a patient this morning, or not this morning, yesterday. And same thing, eating out for almost all the meals. And I said, okay, well, let's just start with picking things at the restaurants that are healthy. And that can be an easy change if you're like, I'm not ready to start making my own meals at home. I don't have the time. So a lot of people don't even know how to eat out healthy at a restaurant. Not at all restaurant food is healthy.
In fact, most of it probably isn't, but there's ways to modify try just about anything to make it
Right.
reasonable. Yeah.
Yeah. And where do you live? You live in Florida, right?
I'm in Florida.
Yeah.
Yes.
So you probably have healthy options in most of the restaurants.
I would say we do in most places, but you can still find bad food anywhere. So you have to be conscious about what you're eating, what you're
Right.
choosing. And I would
Hmm.
say most of the time you've got that choice, but you
Right.
you have to make it.
Yeah.
That's part of it. Yeah.
Yeah. And when I go out and I don't see anything I want to eat on the menu, I'm always going just for salad and protein. That's like pretty
Right.
basic. And they can
Yes.
usually make that, right?
Right.
They're like, okay, I don't want this on it. I want just salad and protein. Okay, we can
Yeah.
do that. Like we have that.
Exactly. Yeah. And I think too, for most people, it's okay to have a little bit, right? Don't lose your mind if you're like, oh my gosh, they put cheese on it. Okay. It's okay.
Right. It's okay.
Right.
It's not going to kill you.
And so appreciating too that when we enter into this health journey, and I'm sure you probably had the same, I didn't go all in at first. I was
Right.
in 50%, and then 60%.
Right.
And now I'm still at 90%. There's still times
Right.
I enjoy things, but I've optimized my health so that I can. And I think that's the important
Mhm.
part of like, what are your goals right now? Because
Mm.
if it's really to get pregnant and have this baby, then okay, maybe we need to pull back the reins for a little bit so you can truly do that, have a healthy pregnancy, have a healthy baby. And then you can decide for yourself what things are you willing to give on, what things are going to be important to you to
Mhm.
continue. And hopefully 9 months, a year from now, you've built some good habits that you can sustain throughout that first year of life when things are tough as a parent. So,
Right. Yeah. It's not going to be an easy journey if you're already struggling before the baby
right.
comes.
And truly, that's where I got to where I am actually in
Mhm.
building my own practice
Right.
and leaning towards helping young moms and young families in general is I had my son at 37 and 2 months
Mhm.
later, and I should probably add on the first day of shutdown of the pandemic, right? All the things that could have been hard for me. I was
Oh my
older,
gosh.
and 2 months later, I was like, I sleep better than my husband. He's a great sleeper and that matters, but we had all the things in the right place. And I wanted to be able to share that with other people because you don't have to
Mhm.
feel exhausted. You don't
Right.
have to be just, oh, mom mode or mom brain or whatever for the rest of your life. In fact, I think that's another American falsity that we've all bought
Mhm.
into. And I don't
Right.
want other moms to feel like they need to be that way either.
Yeah, that's so true. And I like what you said earlier about community. There's so many resources, just like yourself, and reaching out and finding those resources in your community, asking for help. And people used to have a lot more kids, and people are still having more than one. But I
Mhm.
think that's where kind of that idea comes from. You're talking about that false idea. It's
Right.
true. If you had 12 kids, you probably were totally burned out because
Probably
you had
were.
one after the other.
Right,
Right.
right.
Yeah. Your
Absolutely.
body was like, okay, I'm done.
Yeah, yeah. But I find that a lot of moms will come to me after 2 or 3 and
Mhm.
they're like, "Yeah, I'm not myself anymore. I'm just,"
Mm,
and we go back and these principles have never been applied. So I love to now be able
right.
to address it on the front end,
Mhm.
set parents up if they're ready for that family, let's start from a healthy baseline so that you don't ever get to that point either.
Yeah, so true. Okay, so what are those foundations? Let's talk about, we talked about nutrition. Let's talk about we talked about I wanted to talk about like recovery phase. Is there
Oh,
a
yeah.
change in nutritional needs for that recovery phase? And I think we're just talking about that right now. It depends, of course, on the delivery and the labor. There's lots
Right,
of different scenarios, but in
right.
general, are there aspects where the mom needs to look at that recovery phase a little different compared to genetics? Like maybe I need more
Sure.
sleep, or maybe these foods are going to help me in that phase.
Yeah. And I would say, even preemptively, are you exercising throughout pregnancy? I feel like
Hmm.
so many OBs don't give any information on that. The PT, I'm really passionate about that because the more you can have your body physically prepared, right? Labor and delivery or a C-section, wherever you end up,
Hmm.
is the process. It's a physical marathon for your body.
Right. Right.
And so, and I think you have to look at it that way. Too many people just brush it off as it's just birth. And while yes, we've been birthing babies for a long time, it's still a lot physically on your body. So
Hmm.
absolutely recovery. And I think more sleep would be ideal, but more sleep is hard to come by when you have a little one and they're
Right.
up and feeding all the time. So it comes back to that village and that support again of, who
Hmm.
can you pull in and how can you ask for that help? Be okay to say, hey, you know what? I need you to take the baby for a couple hours so I can sleep, or
Right.
please clean my house so that I can enjoy this cuddle time with my child while I rest
Mm,
and recover. I think those are super important.
mhm.
Nutritionally, absolutely. And some of that again comes back to what kind of delivery,
Right.
and also, are you breastfeeding or not? Because certainly calorie requirements go up and healthy fats go up and lots of other things go up when you're talking breastfeeding. But in general, again, that low inflammatory diet is going to help your body be able to move through the recovery process quicker than if you're eating a bunch of sugar and carbs and
Right.
all the things you probably crave, especially in that moment when you're sleep deprived, because we know that's going to increase those
Right. The
cravings.
quick fix of energy. Yeah.
Exactly.
Right.
But appreciating that the more you can treat your body well in that moment, the better you're going to come out and the quicker you're going to come out of that as well.
Right. Oh, love that. What about from the mental health perspective and the genetic report? Because a lot of women experience postnatal depression.
Yes.
And I wanted to know if you would talk about that a little, because I think we see a lot of genetic information or epigenetic information about mental health. And do you use that as a way to, in that prevention phase with your patients, and in that saying like, these genes are present and we need to be really proactive in this postnatal phase?
That's a great question. So I would say Grow Baby is more focused on the pregnancy itself. And so we get less specific information related to that, but I have other tests that I use related to that. So definitely can get that information. And I think it's super important. So when moms come to me and say, I'm worried about this, or I have a family history of this, or I already struggle with anxiety, we want to make sure we're looking at that information to optimize now, but then like you said, post baby as well. And so there certainly are those factors to say, okay, this is a bigger risk for you because you carry these genes that might predispose you to mental health challenges. But most of it post birth comes back to a lot of what we've talked about already. And so we know those risks go up. For example, if you're not getting enough sleep. So of course, postpartum, that's hard, right? Yeah. Okay. Go sleep. Sure. But I think you have to prioritize your health. You would absolutely prioritize everything for your baby in that moment. And as mom to mom, I think you have to do a better job of prioritizing yourself, speaking up for yourself and saying, no, I need a break, or no, I need some support, or no, it's time to see my practitioner because I'm just not feeling well. And those are all super important things that I would advocate for any mom to take on after they've had the baby and are working through those feelings.
Oh, so important. I love that you said that, especially checking in with your practitioner. If you are having some of those symptoms come up, they are quote unquote normal in a small, in some amount, right? Because our hormones are changing and we're going to have a big shift, but there's a difference in postpartum depression and a normal postpartum delivery or normal phase after delivery.
Yeah. And I think unfortunately, I'm glad we're recognizing it. We're treating it, right?
Yeah.
But unfortunately, oftentimes what we treat with, or what I hear from a lot of moms is they offered me medication and I don't want to take it. And I had a mom not that long ago say to me, I'm not taking it because I'm breastfeeding and I didn't like that. And so I'm afraid to go back because I'm afraid they're going to take my child away because I'm not taking it.
Whoa,
like, this is the wrong place in society if that's the feeling you got, because we're
that's
practitioners here to help. Exactly.
Yeah, exactly. Yeah, that's intense. Yes. So hopefully that's not happening out there a lot if you're listening and you're tuning in, but know that there's support. And there are lots of natural alternatives like Dr. Quartano is talking about to help with depression, but reach out for a practitioner if you're experiencing some mental health changes post-delivery and get the support you need. I think that's what your main point was. Get the support. And we're out here. We're here to help you.
We are. And there's lots of different methods. It doesn't just have to be medication and we're done. There's therapy, there's lifestyle, there's diet, there's supplements. There's so many different options to try.
Just taking a break from giving, like you said, that self-care piece, which is really important for the mom and the baby and the family
and sleep, right? And sleep is so underrated, but it can influence.
Let's talk about sleep.
Oh man, sleep is so important. And so for any mom who's ever been pregnant, right? They're thinking, because by the second trimester, you're like, I'm up all night, right?
Right. I know I can't sleep. My body is not the same shape anymore. My husband's in the same bed. There's
other children. But we know genetically, one of the things that can be influenced is melatonin and melatonin cycle. And even just thinking whether that's a genetic risk for you or just that you're struggling to sleep, about those healthy habits for sleep. And I think that always starts first thing in the morning. You're groggy and you're not feeling well and you think, I'm just going to roll around in bed. That's not helpful. Getting up and getting our phone first thing in the morning, not helpful. So open the blinds, get lots of light. I know. But people think like, well, it's fine, I'm awake, right?
Right.
That sunlight, that natural light is what sets our cycle for the day. So we want to make sure first thing in the morning, we're starting off. And then obviously into the evening, many more things we want to do, getting rid of that light. So shutting off our lights, turning down the lights in the house, using lamps, getting rid of the
Mhm.
cell phones before bed,
Right.
having a routine, just like we have with our kids, I think
Mhm.
is huge. So we don't expect our kids to go from 90 to nothing and put them to bed. Almost every parent has a bedtime routine and a bath and books and whatever that is. We
Mhm.
deserve the same. You can't go from like cleaning the house, making lunches, working, and now I'm going to crawl in bed. It's not going to work. And
No.
so you need to set yourself up for success with that as well.
Yeah, that's so true. And in regards to melatonin and cortisol, our stress
Yeah.
hormone, recommend doing hormone testing after delivery within a certain amount of time if you are not seeing any changes, or you're seeing the changes on the opposite end,
Exactly.
drastic changes. Yeah.
Yeah, I think it depends on where they are, obviously, but usually we'll start with some lifestyle interventions, especially as those hormones are still regulating. By
Right.
6 months postpartum, if things are still wacky or not getting any
Mhm.
better, then I absolutely want to start looking at some testing so that we can be more prescriptive and maybe supplementing and supporting and bringing those hormones back into alignment. But a lot of times, what I find is it's the rest of the things, the recovery from having the baby,
Right.
the maybe not eating the best diet because you're not cooking or you're exhausted. And so you're eating what's
Mm.
in front of you or the fast food. And so we creep back into those inflammatory lifestyle changes
Right.
that aren't necessarily helping. So if we can start there, I think oftentimes people start to regulate better. But certainly by 6 months, if things aren't getting better, I think it's a good time to start looking.
Mhm. Yeah, that's great advice, because that is a good time period for when your cycles or your hormones are starting
Right.
to regulate more.
Yes. Yeah.
Right.
Because
Yeah.
early on, they're so irregular that
Right.
that testing may not really be helpful in
Not give a good enough clear picture. And so
exactly.
in relationship to sleep, and let's go back to that a little, what are some, you talked about lifestyle. So what are some of those lifestyle tips that you can give for helping with regulating sleep? From looking at the genetic report and seeing specific lifestyle tips that can be helpful. And then also what can people, what can moms bring in during the phases?
Sure. Yeah. I think it's always challenging. And I've had parents come to me before and say, oh, I don't want to take anything again. I'm breastfeeding or whatever. And so
Yeah.
they're certainly appreciating that you need to work with a practitioner because it's going to depend on where you are, how much breast milk they're
Hmm.
getting. There's lots of things that are breast milk safe.
Hmm.
Melatonin is actually one that probably does cross into the breast milk. So not necessarily
Hmm.
what you want to use, but there are some other products that you can use, ashwagandha being one that is
Hmm.
believed to be pretty safe, magnesium being another.
Hmm.
So those are supplement wise things that I've often recommended for moms who are struggling
Hmm.
either during pregnancy or after, because their lifestyle, like I said, it's just a lot of those adjustments in your routine and making sure you're setting yourself up for success. Caffeine is another one. So how will you process caffeine can be
Right.
something we know, either you know it yourself or we can test it genetically and find out
Hmm.
like, okay, maybe you need to be a caffeine avoider, or if you're going to
Right.
have caffeine, maybe 1 cup first thing in the morning so that it's out of your system before you're trying to get ready for bed.
That's
So those,
totally me.
yeah, same.
Yeah. I'm like, if I have caffeine after, like, even after 2 o'clock, I'll be up till
Mhm.
like 2 in the morning.
Yeah.
Like, oh
And a lot
no.
of times what I find, right, is you work backwards and you optimize that health and they
Right.
don't really need caffeine. I'm at that
Right.
point right now and I'm blessed. I don't
Right.
actually need coffee. I just like the flavor of it. So now
Right.
I'll have a half a cup. I don't really need the caffeine. It doesn't really help me any in a good way. I'm
Right.
feeling energized already, but it's not
Totally.
something I feel like I need, which is something I think a lot of moms struggle with.
Yeah, totally. So you were saying that in regards to the genetic report, we can see that information about caffeine, which I love
Yes.
that piece, because some people get like super wired, or like you said, it doesn't affect them at all. They can drink it at 10
Mhm.
o'clock at night. And that's important for a new mom to know.
Absolutely.
And
Abs-
dad.
yeah, absolutely.
Like, oh,
Yes.
honey, I had the coffee too late tonight.
I know I'm going to be up until 3. I know. My
Yeah. Oh,
husband just
no.
pulls his mask over his eyes and just ignores me. It's like, go, go do you.
Oh, that's so funny. So sleep habits. So there, you were talking about specific things you can take. And could you talk a little bit about herbs? Because I'd love, or that particular piece for the audience to hear the caution around using herbs in pregnancy and after pregnancy in regards to breast. Just because I think that knowledge is good for the audience to hear.
Sure. Yeah. I think first of all, every phase of pregnancy is a little bit different. So as that
Right.
fetus is developing,
Yes.
appreciating that certain things at certain times are going to influence. And for the same reason, when we talk about like alcohol during pregnancy or the risk factors of having raw seafood during pregnancy or those kinds of things change throughout our trimesters,
Yeah.
so do our supplements or our herbs or things we're using. But in general, you're wanting to make sure that whatever you're taking is going to be pregnancy safe.
Mhm.
It's not going to cross the placenta, or if you're breastfeeding, that it isn't going to cross into breast milk. And so ashwagandha is one I like. It's adaptogenic, so
Mhm.
meaning it will help your body support where it needs and is relatively safe. It's been tested. It doesn't cross the placenta in any negative ways, doesn't cross into the blood or the breast milk. And so that is one area that can be very helpful if you're having trouble shutting your mind off at night. And I
Mhm.
feel like a lot of pregnant women have that trouble. Or on the other side of it, post pregnancy, when baby finally starts sleeping through the night, I have a lot of moms who can't stop waking up at 2 or 3 in the morning. And
Oh,
so
yeah. Mhm.
helping to support that can be super helpful. And
Yeah.
yeah, and so magnesium is another one I like for similar reasons. It's safe
Right.
for most of my patients, but there are other things out there. Melatonin is one I probably wouldn't recommend in that
Mhm.
population. And there's certainly other things to work through, but those are two safe places to start and maybe one to avoid that we hear commonly when it comes to.
So important. Yeah. So it sounds like checking with your health practitioner, like you said, making sure what you're
Yes,
taking is safe. And that's true with anything. There's lots of
right.
different foods, like you said, nutrition, supplements, herbs, all those things. You want to make sure they're in alignment with what you need.
Well, and I think that's so important, right? Because we oftentimes see on social media, and I'm in a ton of mom groups and I love it, but oh, I'm struggling with this. And there's 47 things thrown out. And I know as a practitioner, okay, that's good if you have high estrogen, that's good if you have low estrogen. Like the problem is it's not your hormones, right? Like your
Right.
hormones as a whole aren't the problem. It's whatever's keeping you from being balanced. And so
Yeah.
taking all of that is like throwing spaghetti at the wall and seeing what sticks. And
Right.
it's probably going to cost you a lot. It's probably going to make you feel worse instead of better. And it isn't going to get you the personalized medicine that actually is going to get you well.
That's so important. I love that you said that because it's true. There's a lot of advice out there, especially Google is not your doctor. And the support groups can be helpful, but they can be detrimental because that person is not you. They might have gotten that advice from some their health practitioner or from a friend. And that's not, you have a totally different body. So I always recommend if you are listening and you want to take something to check with your health practitioner.
Love
First.
it. Yes.
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 See, and that's important for anything. I'm a doctor and I don't prescribe things for myself. I check with my practitioner because I have a different view. Oh yeah, that would be great. And like, oh no, I
Yeah,
know about what I can take, but I don't prescribe everything for myself
for
particularly.
sure. Yeah, that
Yeah.
makes perfect sense.
Yeah.
And I think for anybody, we know our own bodies super well, but we still
Right.
need somebody who's looking at us from an objective healthcare perspective to optimize our health.
Yeah, all of that. Yeah, optimizing
Mhm.
the health is so important. That's so key. So let's talk. We talked about sleep and nutrition. Let's talk about exercise, which you mentioned a
Mhm.
little bit. How
Yeah.
does the genetic report give us information about exercise?
Yeah. So I specifically when we talk about grow baby, we're looking at how exercise is going to help with some of these different processes. So
Mm,
for example, if your inflammation is high, we might want to be careful to move every day, which is going to help with inflammatory process and keeping things under control, but not high intensity. So we want to
mm,
reel that back in a little bit. For other people, it might be genetically, we know that you're more predisposed to being a good strength trainer, for example. If you're looking to get into exercise, let's point you in the direction that's something that's going to be successful for your body, a place
mhm.
where you can marry that. Or genetically, I am predisposed to be an excellent endurance athlete, and I can't tell you how much I hate running. So, marrying that into a different, more high intensity type workout for me to optimize my genetics, but also to enjoy what I do, because I think that's a big factor that's important
Right.
as well.
Hit training or something where
Yes.
where you're
Yeah,
doing high intensity for small intervals or something.
exactly.
Yeah.
Exactly.
Yeah.
And then we can also find out information about, are you a person who recovers quickly? Do you need more time? And obviously we have lots of smart devices now too, like the Aura rings and things like that, that can give us objective information about that on the fly. But
Mm.
knowing genetically what you're predisposed to can be super helpful. And again, setting yourself up for.
Yeah, it's just so amazing that we can find this out now about our genes, especially when it comes to exercise,
Yeah.
knowing how we can optimize our body's health, which is so important, I think, too, because, we're still in the pandemic and moving. A lot of people have transitioned out of their job into a different job where they're working, like myself. Like I'm working mainly at my home office now, and my activity completely changed because I had to really refocus. Now I do like smaller intervals of workout throughout the day so that my body's not so stagnant. And that I had to change that because I was like, oh, this is not good.
Mm-mm. I love that you made that change though, because I've been working with so many folks right now who are in that position, realized yet, or even busy moms. They're busy and moving throughout the day, but it's not really exercise.
Right.
I have one mom who she's like, I've got weights in the bathroom, I've got bands in the kitchen, and I do like, these are the activities I do. And I love it because it fits in her day. It meets her needs, and she still gets her exercise in without having to sacrifice time with her children or anything else. And so that's super important as well.
Yeah, it's so key. Exercise is so important. And especially in our new phase of a lot of Zooming, it's our body. And I noticed like different aspects of my body that would change the way that they were working, the low back, the hips, the hip flexors, all these different things that I was like, oh, this is different. I need to move my body in a different way to get the blood flowing, especially like in that pelvis region. And as women, when we're sitting so long and I saw my cycles changing, I'm like, okay, I need to do more work for that pelvic region.
Absolutely. And I think coming back to our genetics and things like BDNF, we know is upregulated by exercise. So if you're struggling with the ability to stay focused and have that neuroplastic piece and your nervous system just being on point, you may be a person who struggles with that, and exercise becomes even more important. So
Yeah, so key. Yeah. And there's different ways. For me, I just started setting little alarms and changing my exercise routine and keeping water in my working office too, so that I was always like drinking more water, just things that were more like, yeah, you look at your jug. That's awesome. And you're like, yes.
If it's not all filled throughout the day, I'll run out and then I won't go get more. So now it's all with me. I can't not
What
drink
does it say on there?
It's a gallon. So it's got my you could do this in the morning.
Oh, that's so cute.
Keep it up.
I love that. Yeah,
So.
you did it.
Yep.
That's great. Yeah. And our body needs so much water, so much. And I think that whenever I feel like I'm thirsty, I know I've already gone too far, and that's not good. That's definitely not good.
And I think when we come back and talk about pregnancy, genetics aside, that's so important, right? We've got so much more fluid that's going into our bellies. And so, and volume of blood and everything else, we've got to make sure we're hydrating well. And that can lead to a lot of problems in and of itself.
Yeah. Kidney, blood pressure, edema, all those things can be affected by hydration. Yeah.
Exactly.
Yeah. So important. So exercise is really key. And then when you're looking at that genetic report and seeing the exercise, that you're fine tuning that, and you can also fine tune that once the baby is born, correct?
Yeah, absolutely. And I think that's super important. Getting back into exercise. I just had a conversation 2 weeks ago with a postpartum mom who said, yeah, I had my 6-week checkup, and she is a super fit mom, but was very active before baby. And she said, so can I start exercising? And she said, uh-huh. And she said, any restrictions? She goes, nope. And I'm like, oh, yes. And I think every person is so different. And for some moms, they can jump right back into some higher intensity. For most moms, we need to start with walking, then move into jogging, then move into running, then move into jumping and all those things. And hormones play such a factor in that, because there's so many hormones post baby still. And if you're breastfeeding even longer, that are going to influence your joint integrity and things like that. They're all good things. They need to be there to help us birth that baby and let things move out of place so that baby can get through. But then the reality is we have a lot of joint instability we didn't have, paired with the fact that we now have the space in our abdomen that was filled for a long time. That our body's got to recover from. And so I think the important part is start moving somewhere. Walk every day. Getting outside in the sun is so important for so many other things. So get out and do a 20-minute walk every day. Take baby if you can, or take yourself if you just need that time. But I think that's a good place for anybody to start. Exactly. But then if you have questions beyond that, definitely seek out a provider who's knowledgeable in postpartum and fourth trimester fitness to help you get there.
That's so important. I love that you brought that up, because the body does go through so many changes. And especially if you've had a cesarean or you have had pelvic floor damage, knowledge, it's really important to work with a practitioner like yourself to examine those particular areas to see, okay, is your body really ready to do what type of exercise is best? Let's look at your genetics. What's great for you? How are you feeling? There's so many factors.
Yeah. And that individual can take you through some quick assessments to really give you objective data too, as opposed to just a guess or feel it out. What I've seen too many moms do is go back too intensely early on, and then they're having trouble with urine leakage and things months down the line. We don't want that. We certainly don't want that.
Yeah, that's a really important piece to bring up. And especially I think when particular view of how your birth might go, and then it changes for something you didn't anticipate. And that can change maybe your exercise objective.
Right. Yeah. Well, I think the other thing that changes, the other lifestyle piece we haven't talked about yet, is that stress, right? And that just ability.
Talk about stress.
And that's such a stressful time, regardless, having a baby. And I think working with moms throughout pregnancy of, yes, you've got a birth plan and you've got a vision, but you've got to be okay to be flexible with that, or it can mentally just wear on you. And we talked a little bit about that relationship building with the partner before there's even baby around, and how working through those healthy lifestyle habits can help with that. But I think that carries all the way through really those first couple of years of life, because babies are hard and there's a lot of stress and there's a lot of changes in your body and changes in your relationship. And so how do you keep those pieces strong? And what do you do to remove that stress from your body? Because that's only going to make the rest of these things more challenging if you aren't managing that.
Yeah. And what are some of the factors that affect stress?
Oh, goodness. I feel like they're all interrelated, right? But sleep is a big one.
Sleep.
So sleep can be influenced by stress and can certainly influence your stress level.
Both ways.
And if you've ever been sleep deprived and you've gone off on somebody over, my poor husband, one day I was exhausted and he's, what's for dinner? I'm like,
right. The hangry.
So definitely that, our hormone management, and a lot of that coming back to just things like our diet and what we're eating can definitely influence stress. Relationships and support are another big one.
Yeah.
And then we can control to some degree, but I think one we can definitely always work on, and even post baby early on, is relaxation techniques. So deep breathing, some simple stretching, yoga type movements that can really be helpful to bring that stress level down, stimulate the vagal nerve, which can be really helpful for stress response. All of that can be something simple you can do throughout pregnancy and postpartum as well.
Oh, great. Yeah. Stress is so important. So important. And I feel like when I'm working with patients, it always comes back to stress in some way, whether that's gut or hormonal or mental. It's all coming back to the stress affects everything. It's like how we function in the world.
And that's where I think it's so important. Practitioners like us, we're really sitting down and looking at that history and going, okay, what was this trigger? And almost always it comes back, like you said, to stress. There was something that predisposed this, and then everything else fell apart. The wheels fell off. And so,
so true. Yeah. So putting all the wheels back on the wagon. Yeah. So as we're wrapping up things today, Dr. Quartano, what are your top 3 tips for fertility recommendation? For you, like, hands down, these are the top 3 that I would recommend.
Well, that's a great question. So I think if I had to bring it down to just 3, I think it's optimize your body. So making sure that your hormones are ready for pregnancy, because that's going to set you up for a successful pregnancy and a successful postpartum period. And that would be one. And doing that through, I guess, all of the lifestyle factors we've talked about today, but particularly, I think exercise regularly, eat the right foods, and manage your stress. If I had to name 3 of them. So as I'm looking at women in that phase of their lives, that's the struggles I see the most often. And they're usually running from one place to the next. They're used to this lifestyle. They're managing a lot of stress, maybe have high performing jobs. And so all of that is stacking on, and we need to start taking off some of those layers of stress, adding back in the healthy factors in order for them to optimize their pregnancy. And then along with that, I think the second maybe piece of that. So I think that was probably like 4 in 1. I'm sorry. I'll give you just 2 then. How's that? The second one is test, don't guess. So whether you're trying to get pregnant and you're having trouble with your hormones and you're not sure where to go, or you're pregnant and you want to make sure you have that optimal pregnancy, I think either one of those situations is a great time to get some functional testing done, to take a look at your genetics or your functional hormone levels and see where we can go from here to make sure that you optimize that pregnancy and postpartum period, because you want to enjoy that time and it's hard enough already.
Right. Oh, those are great tips. I loved all of them. As we're wrapping up today, let's talk about how people can find you, and you have a freebie as well. And then we'll have one last
Sure.
fun question at the end.
Okay, sounds great. Yeah, we have a website, altogetherwellness.net, and we're based in Jacksonville, Florida, but we see clients virtually and can certainly do any of our genetic testing consults or functional medicine consults virtually as well.
Hmm.
So check out the website there. There is a freebies tab. So we have some good tools there that you can download, whether you're working on getting your body ready for pregnancy or post pregnancy, and you're working through some of the things to optimize your health there. There's some freebies there to talk about some of the tools there, or you just need some help for baby. So we've got some tools there as well for your children and looking at
Hmm.
development for them and healthy habits and lifestyles as well for kids.
I love
Um,
it.
yes. And
Yeah.
then we're on social media as well. We like to post
Yay.
lots of tips. I know.
Yes.
Lots of tips and tricks for health and wellness for your whole family. So follow us on Altogether Wellness on Instagram or on Facebook or both.
Nice. Great. Yeah. And that's wonderful place to find all kinds of health tips. I love your Instagram. It's fabulous. So and there, Instagram is great for resources, but follow people that have the expertise behind it. I think that's important. That's why I think that's
Right.
that's why I love my podcast is because, and then helping people to learn from an expert is very different in
Yes.
the learning process. Yeah.
Thank you. I'm so glad you have this because I love to be able to point somebody to those experts when they ask the questions as well.
Yay.
So
Thank you.
thank you.
Thank you. One last question, Dr. Quartano. If you had an unlimited budget right now, what would you do to make the biggest impact on the planet?
Oh, that is a great question. I would open up a location in every city for families to come together. We don't
Oh,
play enough. So we talk
mhm,
about stress, we talk about exercise, all the things. So families to come together and just have fun, right? Whether
mm,
that's going down the slides, playing in the ball pit, having a healthy lifestyle and snack information, I would have all of that in one place. And
mm.
hopefully we're opening a small version of that in the next coming months here in Jacksonville. But just bringing a place together for families to really come and learn and just be and enjoy, take away the stress of the world and enjoy each other for.
I love that. That one's super easy. We should totally be able to do that, make that model and replicate it. I think that's a great one. Ding, you got that one's, yeah, that one's easy. Some of the ones I'm like, okay, you can have that one, but that's going to take a little bit more work.
Right.
But yes, I think that's a wonderful vision, and it's so needed in community. And I think it could be combined in different ways with other community aspects, which would really be key. I love it.
Yeah.
Thank you again so much for coming on today. I loved our conversation. It was so enlightening and informative.
Great. Yes. Thank you so much for having me. I appreciate it.
Thank you.